So Veriset took about 6 years to develop from the time we did launch it. It actually came out of an idea that we were running a lab, and we have this technology called polyethylene glycol, and we were trying to see how it could be applied in different areas. And we had an idea of, can we use it to stop bleeding?
Being a surgeon, you can imagine that doing procedures, bigger procedures, surgical oncology for instance, you take out many organs, you prepare the tissue, you are in need of something that helps you controlling the bleeding sites.
Medtronic had a great technology, and we were trying to look at other ways and avenues that we could introduce it and use it and expand the use of it. And we shortly found that there was a void in surgery related to hemostasis. And the surgeon is looking for a product that can stop bleeding quickly, can stop moderate to heavy bleeding, in order to help them in the OR.
Today it's my son's birthday. He was born on the 6th of November last year, 2020. So it's his birthday today, and I'm very thankful to God.
This lady had to go in for a Caesar. We took her in, and everything went well. Baby was delivered, and we went through the normal routine of now first doing a cord blood, and after that we took out the placenta. Took out the placenta, cord blood taken.
Yes, doctor.
And that's more or less there where things got interesting.
He told me that I'm losing a lot of blood. The bleeding is not stopping.
See if there's some emergency blooding trauma, please.
So usually when a placenta is in the lower segment, in the placental bed, you start seeing all these blood vessels filling up with blood, and it just oozes out. So at that point, we basically told the anaesthetist, now we're going to have a lot of blood loss, just prepare for that.
I was not sure what was happening, but my doctor, he kept on telling me that everything is fine.
Although inside we started to get a bit of a heart rate going, and started stressing a little bit. We went through the motions. The first thing was to put in lots of sutures in the big blood vessels to try and make sure that there's as little blood flow to this area as possible. And I think I put in probably about 1, 2, 3, 4 different layers of sutures, upon which time we getting to the point where now you're going to do a hysterectomy if you don't have anything else. So at this point, I recall that my colleague, Dr. Merwe, mentioned that a representative from Medtronic came to see him recently, specifically regarding a very good new hemostat.
I remember that I was detailed on a product called Veriset by the representative.
I left a sample with him explaining that when he needs it, I'm not going to be fast enough to get it to him, especially in gynecology where they experience severe bleeds.
And I thought this would probably be our last way out before we get to a hysterectomy.
I think for us as gynecologists, it's always important to try to preserve someone's fertility, meaning that you are going to save a uterus.
And this is more or less the point where we started to get his telephone number, and I asked the sisters, please call from my phone, give to the anaesthetist, and then he phoned my colleague.
I already was thinking about a nice glass of red wine when I received the call from theatre. He asked me, well, I can remember you told me about this product. Where are you? I said, listen, Wilhelm, I'm at home. But give me 8 minutes, because that's about how long it takes me to drive from home to the hospital, and I'll bring it to you.
I was very scared. I thought I'm gonna die. I was thinking of my kids. I was thinking of my baby that was alive and healthy. And now I'm going to leave my child. So I was very scared.
So I got in the car and made my way to the hospital. I remember exactly where I put the sample that the representative left, and then I ran to theatre. But as I was running to theatre, I phoned her.
I was attending a Zumba class at the gym, and returning to the water bottle, I saw my phone ringing.
And all I could remember I said was, Stephanie, dark side up, dark side down.
I answered him dark side, which he was referring to which side of the product must go toward the bleed.
She said dark side down, and that's when I burst into theatre.
Dark side down. Dark side down. Got it? Okay, it's out.
Jan gave me this Veriset patch, and I hold it in my hands for the first time, and after all my sutures, I saw the size of the patch and I wasn't sure whether this is going to work. But he just told me, put the thing with the dark side down and press. A minute goes by and I leave it, and there's no more oozing.
Is it Banga, you still good? Okay, it looks like it's working.
So we waited a bit, and still no bleeding. So at that point we decided, well, it seems like it's working, we're going to close up. And Dr. De Bruin was off to drink his wine.
I was so happy when they told me that they find something that can help me to save my life.
I think we've been waiting for a product like this. I don't think we've ever had the opportunity to work with such a product in specific cases. We do have other hemostats. We've got other powders, and we've got other strings and stuff that you can put in, but they won't stop bleeders like these. We are talking about venous bleeders, difficult bleeders, bleeders that you can put in sutures. They go through it. They are difficult, and that is where this product will be, well, it is number one, and there's not really an alternative.
I think I was lucky to have a sample of the product to actually see how it works in practice, and that we could use it in a situation like this. It proved to be superior to other hemostats.
My personal approach to hemostatic agents and hemostats per se, also patches like Veriset, is that I really like to use it to, number one, prevent rebleeds, number two, to be safe in, I would say, emergency situations.
So what we've heard globally about the results is that, surgeons are, when they try this product, they see how effective it is, and they're actually changing how they do their procedures.
Well, I mean, it's easy, I think, to encourage a surgeon with a hemostatic patch, because it guarantees you the safety for yourself and for the patient.
So, some patients, it's about the tissue quality. When you have patients that have had cancer and have multiple procedures, what we found is a suture and stapler are only as good as the tissue quality.
Usually, a bleeding site needs to be addressed surgically, which means you oversew it, you put heat on it, bipolar, monopolar, electric, and bipolar electric. There are various very, very highly sophisticated machines available, and this is, number one. But sometimes you just can't do it, because when you oversew a structure, you tend to narrow the structure, and if you need to have a vessel patent, it may not be the best to really oversew it, small veins and small arteries and these things. Then it may be better to just put something upon that, keeps the site dry and prevents from rebleed.
Veriset is comprised of two major components, polyethylene glycol and oxidized regenerated cellulose. The oxidized regenerated cellulose is a common component used in other hemostatic products around the world. When oxidized regenerated cellulose comes into contact with blood, it lowers the blood pH level and kickstarts the coagulation process. Knowing what oxidized regenerated cellulose can do, Medtronic decided to use this as the delivery system for the polyethylene glycol technology. This technology sets us apart from other competitors because it reacts in a matter of seconds when it comes into contact with blood. This then forms a seal over the bleed, forcing the blood platelets together to create the all-important blood clot.
The hemostat doesn't need any preparation like others. full hemostasis within a minute, gets excreted through the kidneys, so you don't need to remove it while coming out of surgery. And if further surgery needs to happen, they can actually further dissect through the Veriset and carry on with their procedure, knowing the Veriset will still continue with the hemostasis.
I was involved in the first trial with Veriset to get it approved and, you know, to show how good it is. And when I first have seen and touched the product, I was like, oh, I don't like it. Sorry to say. But then I used it during the trial, and of course I'm still using it, and I really love it, because even though it feels thick and rigid in the very first moment, once you apply it, you know, it gently covers the field of the bleeding site, and I would say almost immediately stops smaller bleeds. If the bleeding is more heavy, like from an artery, then it, you know, takes like 30 seconds, maybe 1 minute. But then you can be sure that there is no bleed anymore.
We hear stories, but to actually meet and see that patient and see what the impact is that, you know, our product, our company has had on that patient's life is amazing. To know that, you know, she's alive today and that she can still have children because of our product really does touch to what we do and our mission here at Medtronic.
And I would like to thank Medtronic very much. I'm so grateful for the product that they introduced that can save lives.